US President Donald Trump is pushing ahead with a major shakeup of childhood vaccinations. The White House says American children are recommended more vaccines than those in other developed countries, and he wants to bring the US closer in line with them. But doctors warn the changes could put children at risk at home and abroad. James Gooderson filed this report for CNA from Washington.
With the stroke of a pen and his Health Secretary Robert F. Kennedy Jr. by his side, President Trump is again trying to rewrite America's approach to childhood vaccines.
That's a big one in my book.
His latest order recommends routine vaccination against 11 diseases for all children, compared to 18 previously. Doctors warn it could leave more children unprotected.
Some percent of those are going to end up in an ICU, and some percent of those are going to die. There's nothing more terrifying for a family, and there's nothing more tragic.
A key concern is Trump's plan to split the combined MMR vaccine, protecting against measles, mumps and rubella, into separate shots. The order also calls for vaccines to be given at separate appointments where possible. Doctors say more appointments could mean more time off work for parents and more chances of missing vaccinations. And these aren't harmless childhood illnesses. Measles alone can cause pneumonia, brain swelling and, in rare cases, death.
What are the costs going to be for parents and for children, and for an ecosystem, a vaccine ecosystem that is in disarray, which has functioned very, very well for decades, but which is in utter disarray and has triggered reactions by states, by medical societies, and by others who are now running elsewhere for their guidance.
The American Academy of Pediatrics has already sued over earlier changes to COVID-19, hepatitis B and wider childhood vaccine guidelines. A federal judge blocked several of those changes, and this latest order could face fresh legal challenges. But there is a limit to what the federal government can do. No matter how many orders the president signs, he can't dictate what vaccines children need to get into school. That's decided on a state-by-state basis. Mr. Trump wants to push states to change their rules, so the real question is how many of them follow him and how much does political ideology come into it? What happens in America also rarely stays in America. Experts warn Washington's shifting vaccine policy risks sending mixed messages abroad, fueling hesitancy even as the US continues backing vaccination against some of the world's deadliest diseases.
Those who are out to spread misinformation about vaccines, will they be encouraged? Of course they've been encouraged. The US global approach still remains very focused on areas of vaccination. Measles, polio, malaria, there are new vaccines coming on board, HPV against cervical cancer, Ebola.
And a former CDC immunization chief says vaccination overseas is also a line of defense at home.
It would be very important for the U.S., for its own domestic health security, to help global programs improve their immunization status. That's a win-win situation. It helps those countries, but it also enhances our domestic health security.
The message from Washington is not that vaccines don't matter, but that when it comes to America's children, less could be more, even as doctors fear less protection could mean more disease. For CNA, I'm James Gooderson in Washington.